is Glizalcina Sala from FENMA Cagayan de Oro. I am a nursing student, and for today's video, I'll be doing the return demonstration for the assessing the head and the face of the patient. So without other further ado, let's get started. So the first step is determine client's history of the following. So now when we are talking about assessing the head, we're going to be doing a lot of these things visually. Just like we are interacting with our patient and having a conversation. Then while I am talking to my patient, while expecting, looking with my eyes by going to be looking at things such as the general size and shape of the head. And I'm going to be looking for things like asymmetric pa siya or any lumps or bumps pa siya. Then that I want to see or that I might see. Okay. Then I'm going to be on looking for these things. Like I can go ahead also to palpate my patient's head. I-palpate na to ilang head. Any hidden things that may not be seen or in the hair or by positioning. Then I'm going to feel for those kind of palpation or alteration as well. So daghan man og, then there are lots of palpation, the cyanosis in head, like during the area i-palpate nato sa patient. There are lots of major cyanosis. Okay. Then for the next step is naman nato palpate si skull. Then after ana kay inspect nato iyang facial features, like iyang nawong, like iyang mga cyanosis kaniha. Then inspect the eyes, or naaba siya edema or hollowness. Dayon. So for the step 6, note asymmetric of facial movements. Ask the client to evaluate the eyebrow and yung eyebrow frown, or lower the eyebrows, close and the eyes, lightly puff ba the cheek or smile. And so, okay. All of these things are going to be important when we are assessing the head. Now, another important thing to remember when we are assessing the head and the face of the patient is that we are not just looking for the alteration from baseline in terms of the physiological changes or objects, things such as lumps or bumps, or asymmetry. Another thing is that such as assessing for the patient sort of general affect. Does the expression on their faces match ba? Kung match ba na expression, the general vibe and mood of the situation. Yan ba sila? Ilang mood ba sa sitwasyon? Now, if we're having a serious conversation and there are giggling or laughing and looking into space, like while we are doing the serious conversation, magkatawa na sila, like, share, come on, like, and having a really, really hard time focusing, that's gonna be a very difficult assessment for me. If we are having a very serious conversation and the patient is talking to me the way I talk to them or the way I'm talking to you, this would be a very effect that is consistent with the mood of the patient and appropriate for the situation. So don't forget to not to just assess for things such as the alteration in health, lumps and bumps, like and asymmetry. We're also looking for the things that we are more subjective, such as whether the patient's affect matches their mood and situation. So lastly, when we are assessing the facial and or when we are assessing the face and head of the patient, is we should also use the 12 cranial hairs. So without further ado, that's all for today.